Hello, I'm Dr. David Cotter, a board-certified dermatologist practicing in Las Vegas, Nevada. Today we're going to talk about Leqselvi and which patients might be appropriate for this new medication for alopecia areata. When I think about Leqselvi, I think about a patient that wants rapid and robust regrowth of their hair. In clinical trials, it works fast and it works well. The patients I'm thinking about is really the next person that walks into clinic that has severe alopecia areata. In the clinical trials, you had to have at least a SALT 50, so you had to have 50% of your hair was missing at baseline. And we see patients like that commonly enough, but you know what? I wouldn't withhold this medication if someone had even a little less hair loss than that. If their hair loss is bothering them, I like reaching for JAK inhibitors early because they work so well and they work so fast for our patients. Even for folks that I have on other JAK inhibitors that are maybe stalled out, they've done well, but they haven't fully regrown their hair. Leqselvi is going to be the medication that I'm going to switch them to. And the reason why is in network meta-analyses, it looks like Leqselvi is going to be the most effective medication we currently have available, at least at clinically available FDA-approved dosing. So if I have a new patient that walks in tomorrow that needs a JAK inhibitor for their AA, I'm going to reach for Leqselvi. For my patients that are stalled out, I'm going to consider switching them to Leqselvi, with the one caveat that we have to check one additional test that we're not used to in the JAK world. So just like any other JAK inhibitor, we need to check our baseline labs. But for your baseline labs for Leqselvi, you need to add in the genotype for cytochrome P450 enzyme, CYP2C9. The CYP2C9 enzyme is what metabolizes Leqselvi. And if patients don't have the ability to metabolize this medication, you shouldn't give it to them. The good news is Sun's going to pay for that genotype for your patients. So just add it onto your baseline labs and you should be good to go.